April is dedicated to raising awareness about the impacts of excessive alcohol use on one's health and well-being. So in today's Wellness with Wood, we discuss the importance of alcohol awareness. And this is really an important topic. Joining us is Dr. David Rzutko with Priority Health. You're the Vice President of Medical and Clinical Operations. First of all, thank you for being here. This is one of those subjects that I don't know that people sit down and have the conversations about. And so we have this opportunity, you have this opportunity to highlight this. What should people during this time period, always, but what would you call their attention to? What should they be aware of? What should they try to achieve as we look at these issues?
Yeah, so really we'd like to take this time to raise a little bit of awareness, just to think about our relationships with alcohol, right? And we want to support safe use and make sure that folks understand all the resources that are out there to make sure that we're using alcohol responsibly.
What do you do if you have a loved one or a friend or someone that you think is over or misusing alcohol? That can be a pretty sensitive subject.
Very.
Yet, for their well-being, for their health, their continued longevity, you need to do something.
Sure. So providing a little bit of space and understanding your own limits, but yet engaging that person in a meaningful, non-judgmental way. So sharing your concerns with them and letting them know that it is okay to reach out for help, and trying to support them in the ways that you can. And you might want to spend a little bit of time educating yourself as well, what resources are out there for your assistance as well.
Yeah, and that one of the things that you wonder about, that there are some misconceptions about alcohol use.
Yeah.
What is, what isn't.
Sure.
And that would take a little education too.
Very much so, yeah. So there are a lot of misconceptions. So we think about moderate drinking being okay, right? That's probably one of the biggest misconceptions, that certain degrees of alcohol in the right instances can be negative and can be bad. If we have comorbid conditions, so concurrent health issues, diabetes, heart disease, malignancies, on medications that sometimes interfere with alcohol, if you're using alcohol in any of those instances, that can be an absolute contraindication. Pregnancy also, right? We wouldn't tell a pregnant mom to drink. So understanding the facts about alcohol, very, very important.
Is there, I think the question that I'm trying to ask is there a handbook? Is there a roadmap? And I know it must be different for other folks, but for everybody. But what do you do for your own self-preservation? What do you do about your own consumption? What are some of the guidelines, some of the rules that you ought to cover to be, if you're going to use alcohol, to do that responsibly? Sure.
So we look to the CDC or the FDA that has established limits for men and women: 1 drink per day for women, 2 drinks per day for men. And then it quantifies the actual drink itself. So 12 ounces of beer is considered 1 serving. 5 ounces of wine is considered a serving, or 1.5 ounces of hard liquor, and that would be considered 1 serving. Now that doesn't mean, Rick, that we save them all up and do all on Saturday, right? Because that would be definition of binge drinking.
Right.
So again, to protect yourself, knowing what your own health risks are, very, very important. Because again, if you're pregnant or have a comorbid condition, or again on medications that can interact adversely with alcohol, any of that limit, even though the CDC or the FDA came out with that limit and said it's okay, you might have a problem even with that level, right? Or if you've got already problems with the liver or other conditions that would preclude that use. So it's kind of a simple question, but a hard answer, because it's different for everybody. It needs to be individualized, and folks' responses do differ to the same level of alcohol, again, based on body size and body composition.
Yeah, so what I take away from this conversation, brief though it is that people, all of us, maybe need to know more. Where can we go to get some of that education that you're talking about? Because just in the last few minutes, you talked about the approach of giving people space, maybe a little grace, trying to understand what's going on. And that might not be the first thing that people think about, and I bet there are other things that they could learn too.
Really just understanding your relationship with alcohol, how it fits into your life, and should it fit into your life. And one thing I do want to let folks know is 30 years of clinical practice, I've never actually recommended someone start drinking if they're not a drinker, right? So that probably is good to start with. But yes, there's lots of resources. At Priority Health, we do have a litany of education materials on substance use and abuse, addiction, alcohol, and many other medical conditions.
Doctor, thank you so much for your time. I appreciate you coming in, and I think there'll be some people out there that get a good takeaway from this. Thanks for your time. Come back and see us.
Will do. Thank you very much for having me.